Physicians for Social Responsibility began in 1962, heralding the medical concern that there's no medical response to a nuclear war. Health threats of radioactive materials found in humans from nuclear testing spurred development of the first treaty to limit weapons testing. Concerns over a nuclear power disaster revived the organization in the late 70s, and the Cold War threat galvanized the organization to develop a worldwide coalition called the International Physicians for the Prevention of Nuclear War, calling on physicians to act. Since the 1990s, the organization also responds to the global threats of toxic chemical pollution on human health. PSR was one of the first organizations to alert Americans to the threat of global warming to the health of people worldwide. 50 years later, our organization has evolved to form a unique, nationwide network of health professionals committed to the prevention of nuclear war and proliferation, to reverse global warming without nuclear power, and the toxic degradation of the environment. PSR's objective is threefold: to reverse climate change without building expensive, dangerous nuclear power plants, to eliminate nuclear weapons, and to reduce toxic chemical threats. Our medical experts expound on the health threats of these issues to create change in policy and practice. Extreme storms caused by climate change are already affecting our health. Nuclear weapons would be devastating if used, and nuclear power damages our health when there are accidents, such as at Fukushima. Because these threats are so large, PSR works to prevent them. Our strategies include challenging proposed coal-fired power plants and closing the dirtiest ones, defending the Clean Air Act, and pushing for new chemical regulation reform. We also stress the high economic and safety costs of new nuclear reactors and elucidate the dangers of radiation. We push for the elimination of nuclear weapons through our public education campaign, One More for Zero. Until we achieve that, though, we're attacking the nuclear weapons budget and working for passage of the Comprehensive Test Ban Treaty. PSR is successful because we leverage media to transmit our critical message. PSR links national policy issues to the health concerns of average citizens. People are astonished that climate change and heat waves increase asthma. PSR members are able to articulate the impact of these threats in a way that policymakers can understand. PSR chapters around the country are integral to achieving our program goals. Health professionals embody a high level of public trust, so when we work with other groups, we can expand broader campaigns for social justice and environmental health with greater success. Our physicians and health professionals testify at city councils, for state and federal legislation. They work on state advisory boards and speak to editorial boards on our issues. We have nearly 50 years of experience in communicating the medical consequences of national security and energy decisions. Plus, our national and chapter staff has specialized expertise in grass tops organizing. PSR is effective because we operate from the belief that informed activism is principled and effective. PSR aims to provide science-based materials for its network of members and activists to work at the grass tops level against nuclear weapons, global warming, and environmental contamination. The combination of medical expertise and dedication to create change in public policy makes for a powerful combination. We're able to target swing states on federal policy, both in the local media and with legislators. Our advocacy and program work is accomplished through a collaboration of our national office and local chapters located throughout the country. In addition, we bring the health voice to broader campaigns with larger organizations who are more effective at empowering the grassroots. We also advocate within organized medicine through organizations like the American Medical Association, the American Public Health Association, and the American Academy of Pediatrics to educate on issues of climate change and toxic exposure of children. Success for PSR is ultimately measured in public policy changes that safeguard human health. Examples of successes include passage of the New START Treaty that will result in 1/3 fewer nuclear weapons in Russia and the United States. Another example is the EPA rule controlling mercury and other air toxics emissions from coal-burning power plants. This came following a 22-year fight that included 2 successful lawsuits against inadequate prior regulations. We are successful when we increase the number of health experts on our issues and by the growth of our chapters. As our chapters grow and thrive, they're able to work on a wider array of local issues that impact their community's health. West Coast chapters are helping to create a sustainable food system for hospitals, reductions in pesticide use, in addition to working to advance our national policy goals. Many people think PSR is very large because of our reputation. During the aftermath and the ongoing crisis at Japan's Fukushima Daiichi nuclear facility, PSR formulated a swift response to provide a medical voice during a time when few had facts. With volunteers and few additional monetary resources, PSR reached out to the press and deployed resources at the national and international level to provide credible medical and scientific information about the unfolding public health crisis in Japan. However, we have room to grow, and we're seeking stronger funding to do so. PSR was very successful in the 1980s when public knowledge and concern over nuclear weapons was at its apex during the Cold War. However, these weapons aren't gone, and the nuclear power plants in this country are aging and becoming more of a public health risk from accidents. Despite low public awareness, we continue to provide resources and medical commentary to the media to reduce reliance on dangerous nuclear power and to work for the elimination of nuclear weapons. PSR led in the creation of the Persistent Organic Pollutants Treaty, passed and signed in 2001, phasing out the 12 deadliest chemicals in the world. We've also worked for 22 years to reduce mercury emissions, a severe brain toxic, coming from incinerators, and most recently celebrated the EPA decision to slash mercury emissions at power plants. PSR was instrumental in the passage of the first treaty on nuclear weapons, stopping atmospheric clouds of radiation from testing in 1963. In the 1980s, PSR organized medical symposia throughout the country, explaining the cataclysmic effects of a nuclear attack that resulted in further nuclear weapons reductions. We won the Nobel Peace Prize in 1985 as an affiliate of the International Physicians for Prevention of Nuclear War. Our most recent success in nuclear arms reductions is the passage of the New START Treaty in 2011. Nuclear weapons technology spawned the nuclear power industry with no solution to nuclear waste. PSR has successfully used the economic argument against building any additional plants over the last 3 years, despite federal loan guarantees. Our advocates have succeeded in stopping construction of proposed new coal-burning power plants in 5 states with our coalition partners. We've also contributed to the early closure of 2 plants in Washington and Oregon, reducing carbon pollution that drives climate change. One challenge that we often face is that young people under 35 who didn't live through the Cold War don't believe we even have nuclear weapons. Raising awareness and stimulating concern is a challenge for PSR and the entire anti-nuclear movement. Last year, we held a student conference to bring focus to this issue through a social justice lens. We emphasized that plants that build nuclear parts and the cleanup of the most toxic sites in America contaminate low-income or Native communities. Another challenge for us is working to broaden the horizon of physicians. Doctors are committed to their patients, and convincing them to embrace activism for the public's health is tough. We engage new activists, though, through conferences, medical school presentations, and earned media, and then increase their knowledge base about these issues. We're also reaching out through organized medicine to reach a broader audience. Our work builds by teaching and activating new health professional advocates. We have a plan to expand and formalize science-based materials on the issues of toxics, nuclear power, climate change, and nuclear weapons. This plan could be launched in a more systematic way to create more capacity with an infusion of support. We'd then be able to offer the same model along with tools of advocacy within medical schools and residencies across the country. Policy work on climate change and chemical toxic reform has stalled in Congress. More work needs to be conducted on a state-by-state basis. Increased funding for organizing in states without current chapters would expand our work to block coal plants and support EPA regulation of carbon pollution, all of which reduce climate change. The same is true in advocating for cutting the nuclear weapons budget by outlining the risks and safety issues. There are many solutions to our energy needs that PSR would love to champion. The cheapest non-polluting energy is electricity that isn't generated. Solar and wind energy create electricity with much less pollution and also drive a new energy jobs program. Energy efficiency policies not only make sense and create jobs, they build healthy communities that are walkable and sustainable.